Today is the beginning of a 3-day series on immunization as we commemorate World Immunization Week. And as you all know, we cannot talk about immunization without vaccine and the whole vaccination process. It works hand in hand. There has to be a vaccination that leads to immunization. Vaccine is any preparation that is administered to stimulate immune system to produce a specific response that inactivates or destroys pathogen. Vaccination is the process of administering vaccines to prevent disease, while immunization is a process of inducing immunity artificially. Immunization is in two parts: active and passive immunization. Active immunization is stimulating of the immune system to produce antibodies against an infectious disease or infectious agent. Example is a person's resistance to strep throat due to previous infections, or a person's immunity to polio due to polio vaccines. Passive immunization is the administration of exogenously performed antibodies. This immunity caused by this immunization is temporary, and we have the example of the antibodies babies receive from their mother's placenta and breast milk. Contraindications to immunization is a severe allergic reactions to vaccines components. They're usually rare and temporary. We have non-absolute contraindications that includes that a severe immunocompromised person should not be given live vaccines, pregnant women should not be given live attenuated vaccines, and a severe combined immunodeficiency person should not be given rotavirus. Precaution to immunization is a condition that increases the chance and severity of a serious adverse reaction that can compromise the ability of a vaccine to produce good immune response. An example is administering measles vaccines to someone with passive immunity to measles from blood transfusion. Several factors are taken into consideration before vaccines can be recommended or can be administered. These factors include efficacy of the vaccines, cost effectiveness, age recommended for healthcare visit, epidemiology of target disease, risks of adverse events from the vaccine. So one of the factors that is up for discussion today is the age of recommended healthcare visit. In Nigeria, we have a childhood immunization schedule, and this schedule has a list of vaccines that should be taken depending on the age of the individual. There are vaccines to be administered at birth, at 6 weeks, at 10 weeks, at 14, at 9 months, from 12 months to 15, from 2 years and above, and 9 years and above. Also, stock of vaccines that will need to be administered as a result of new emerging disease like COVID-19. Check out our comments to see the vaccines that are administered at these ages. Despite the proven benefits of vaccination, Nigerians still struggle with vaccines-preventable diseases and perennially low immunization coverage. Among these challenges are inadequate funding of healthcare services, religious beliefs and misconception regarding vaccination and vaccine safety. Also, weak access to health services. These factors lead to low immunization coverage in the country. Health services, including immunization services, are poorly funded in Nigeria, and when funded, it comes from external donors. And due to tenacious funding, many of these vaccines are not given on demand. In these last decades, Nigerian healthcare landscape has been bedeviled with strike from healthcare workers. This strike has caused negative impact on immunization, as many clients work to the hospital and are turned away during this period of strike. Religious and political consideration has posed challenge to immunization, as there was a rumor in 2003 that circulated that vaccinations have been given to reduce the population of the country, which didn't sit well with some people and hence reduce the administration of vaccine. In addition, there have been unrelated deaths that has been attributed to immunization, thereby reducing confidence in vaccine services. I hope you have been able to gain one or two during the course of this immunization series. Read more about contraindications and precautions to immunization, as this will further sensitize you and bring awareness to your knowing about how this immunization process works. Turn on your notification as I take you on our next exciting series.